Hello, good evening, and welcome to the session 2. I'm good, thank you. All right. So today's session will be talking about two things: muscles and the major arteries and veins. Yes, Vaijan, you can definitely start directly from abdomen. However, there'll be few points, but don't worry. In any case, say if they are pertaining to lower limb, I'll keep on telling you about that. Right? So nothing to worry. You can definitely start straight away with abdomen. Okay. So what I was talking about is that in today's session, we'll be talking about muscles and some of the major veins and arteries. Now, why such topic? The reason behind it is that many of the arteries, many of the veins, right, they are described in the book in a very patchy way. So at times you find it difficult to orient yourself that where exactly you are. Now today you'll be getting a complete picture of that. Okay, these are the arteries which we shall be studying. This is the dual circulation, dual blood supply of liver. This is how the entire hepatic circulation goes on. These are the principles. Everything would be crystal clear about azygos, hemiazygos, right? We'll be covering all of them. The idea is that when we'll be actually learning any of the organ, right, and when we say that okay, now we'll be talking about celiac trunk, so instantly it should be clear in your mind that okay, this part of the aorta and this is the celiac trunk, this is the like splenic artery. Perfect, no confusions, right? Though at that point of time we shall be revising it, but that revision would be bit quick. Correct? Okay, I am good, much better. But yes, still I am on Epiget. The idea is that D-dimer was so high, so just to prevent that pulmonary embolism. So still a long way to say that I'm absolutely fine. But God's grace and because of all of you, I'm much better, much better. Right? All right. Let's start with our today's topic. Right? So here it is. The first one. Now this is anterior abdominal wall. As such, it's a complete separate topic and we shall be taking that anterior abdominal wall, right, in great depth about the rectus sheath, everything. But this is what we need to know, the basic. Namaste. So here is the first muscle, and this muscle is external oblique abdominis. Right? Name itself is sufficient. The name is telling that this is the external muscle and it is obliquely placed. So we need to know the direction of those fibers. That's the direction. In fact, we can really see that, right? Nothing more to even cram also, right? That's the direction which we see. Now, external oblique abdominis, it's a big muscle, right? It's a big muscle. If you really look at its origin, right, it originates from all those ribs, right? All those ribs, see, right? They are originating from lower 8 ribs, right? Say lower 8 ribs, right? From their shaft, right? From the middle of the shaft of those 8 ribs. But when it comes to insertion, can you figure out that, see, here there is formation of aponeurosis, right? This is formation of aponeurosis, right? A flat structure. And that's how all of them, they merge. But interesting part in this case, which we need to remember it is this lower border, right? It is this lower free border. This is the lower free border, which is giving us that famous inguinal ligament. Now we'll be having a separate session for all the various types of hernias, right? The inguinal hernia, direct, indirect, femoral, spigelian, umbilical, paraumbilical, right? All of them, lumbar, all those hernias will be discussing at length with absolute clarity that how to diagnose it, right? But instead of jumping straight away to those hernias, right? It looks very exciting that yes, this is a clinical topic. No, what we'll do is that you should understand that yes, when it comes to indirect hernia, why it occurs in males, right? Why it goes all the way from one ring to another ring and then it goes into the scrotum, why the contents, they really follow that direction. So whatever the structure, whatever the base which is needed to understand all of them, right, we'll learn that thing first properly, right? And then we'll be going for step by step all those hernias, right? And they are actually very easy, actually very easy. Because once you know the structure, you'll find that yes, it can be there only, right? It's so easy. Okay. So yes, in this, at some point of time, I might not go into the detail of that particular muscle because in any case, anti-abdominal wall will be discussing at length, right? At length, even in 1 or 2 sessions, even more, right? Depending upon how much we cover. Okay, one more important structure which you must know, right? You can see that. Here it is. I'm changing the color. Here it is. That is superficial inguinal ring. Just have a look at that location, right? This is superficial inguinal ring. And as we always say that there must be somewhere the deep inguinal ring, otherwise they would have named it as inguinal ring. Yes, there is deep inguinal ring. I'll show you as it arrives, right? Hernia is like the contents of the abdomen when they try to come out through various paths, right? That is what is called as the hernia. Okay, so, oh, this is good, right? Many times you guys internally answer the thing. I like that, right? That is really, it in fact decreases my burden. Oh, see, really. Very nice. Yeah, that's true. Bulging out something from abdominal cavity, that is called hernia through various paths, right? Sometimes they come out directly through the abdominal wall or through umbilicus or paraumbilicus or lumbar, that is from the posterior side, or from the femoral triangle, Hazelbeck's triangle, or from those rings, that is superficial, that is the deep and the superficial inguinal rings, and they are given various names, right? So we'll see that. Okay. Excellent. So this was the first muscle, right? External oblique abdominis. Moving on to this second muscle, right? When we really remove this first muscle, we come across the second muscle, and this one is internal oblique abdominis, right? So easy. So this first was external, this is internal. And that's how, say, the fibers are, right? Say there is formation of this aponeurosis, which is in center. Okay. Still we go deep, and here it is. This part is really interesting. Say this one is rectus abdominis. Right? This is the reason all the gyms are working. All the gyms are flourishing. But because of this one muscle, right? The classical, which is called as the 6-packs or 8-packs, right? See, everyone has got 6-packs, right? There is nothing new. And where are those 6-packs? Those six packs are, this is pack 1, pack 2, pack 3, pack 4, pack 5 and pack 6. These are the six packs. They are present in everyone, right? But when they are getting displayed, so that they are called as the six packs or eight packs, when even these above are also seen. See, basically rectus sheath is nothing. It's, I'm sorry, rectus abdominis is nothing. It is a muscle with in between, right? In between over here. These are tendinous intersections, right? They are tendinous intersections. So everyone has got these tendinous intersections because it prevents bowing of the muscle. So it's like when you do crunch. So it's not like that the entire rectus abdominis, it comes out, right? So that is because of this tendinous intersection. And one more interesting thing, that this rectus abdominis is covered by rectus sheath, right? Rectus sheath. So that rectus sheath covers it anteriorly as well as posteriorly, right? Again, it is a big topic. Yes, we'll be discussing about it at a later stage. Rectus means straight. Rectus, okay, we have talked about it. Rectus means straight, right? Wherever you get the word rectus, that means straight, right? So it is straight. And this rectus sheath is that aponeurotic sheath which covers rectus abdominis, right? Anteriorly and the posteriorly. So we will talk about it. Anterior and the posterior. It has got anterior wall and the posterior wall. Right? So yes, all guys, the thing is that these sheaths means all those, in gym they say kyare bus boss, within 6 months, within 3 months, right, you'll develop 6 packs and 8 packs. The idea is, see, everyone has got these 6 packs. The only thing is, when the body fat, right, when the body fat is low, so then these tendinous sheaths, they are seen. Otherwise, they are covered by fat. So the idea is that those who are having 6 packs only, they are powerful? No way. It has got nothing to do with it. So that's why, say, if you guys wish, we can take even one entire session on fitness. It's in my mind since very long time, right? And say within last 2 days, I got 4 such mails, and they were regarding the fitness only. So that's why I'm telling this, that there is a difference between an efficient body and that shoka body, right? So which is just for show. Efficient body means it's like, can you run, can you say perform all the various functions of the body effectively? Yes, that is what should be the criteria. However, in today's world, this is more popular. This is more popular. Means the biceps should be bulging. There is like 6 pack and 8 packs, all because of this faltu, this media and everything, right? Because it's like it's shown like that, that with that structure only, the person is good, right? So when you really, there is an exercise called kettlebell, right? Kettlebell. In fact, this is the exercise which was not very popular till date, devised by Russian commandos. Now this exercise is so powerful, you do it only 6 to 7 minutes a day and you'll see the difference. You'll see the difference in yourself, right? It actually makes you powerful from its core. Now because this is abdomen, and that's why I said that this is like an AHA series, right? AHA means you will be learning so much about even your own body, that okay, this is so important. These are the cores which we are talking about. These are the muscles which are so important, right? Why Kegel exercise is so vital for everyone. So that's what we'll be discussing as we progress, right? Okay, okay. So I think if everyone is, yes, we'll definitely do it, right? We'll definitely be doing it, that fitness and exercise session. And what I'll do is, I'll try to put even some of the videos. That is because, say, if I keep on showing you over here, drawing everything, right, it would be difficult. But actually, if I show you that how to do that kettlebell exercise practically, right? So I'll shoot some of my videos on the ground, and because those things cannot be done at home, right? So I'll show you that. I'll shoot that, and then we'll merge everything over here, right? One important point, you do have that mail address, so meantime you can keep on sending me the mails about any of your queries, right? So I'll merge all those queries into our session. Okay, so we'll do it that way. All right, chalo. So that was the rectus abdominis, right? And just underneath it, this one, right? This one, that is transversus abdominis, right? Transversus abdominis. So we have like, here it is, right? Here it is. This is transversus abdominis. Yes, yes. Right? Transversus abdominis. Now, these functions, right? All these abdominal muscles, there are some classical functions. One, the support to the abdominal organs, that is okay, right? That is quite sensible, means quite understandable. It is also very important for expulsive acts. Expulsive acts. Expulsive acts is like micturition, right? Passage of urine, defecation, passage of stool, right? Parturition, that is delivery of the baby, and vomiting, coughing, right? All those are like expulsive acts. That's where abdominal muscles, they play a major role. One more important thing, we know that inspiration, right? Inspiration is an active process. When you breathe in, it's an active process. But expiration is a passive process. It is because of the elastic recoil of the lungs and all those muscles, right? They just relax, right? And that's what leads to expiration. So expiration is a passive process. Nothing is needed. But when this expiration is like a forced expiration, yes, that's where the abdominal muscles will come into picture, right? So when we say forced expiration. And fourth, obviously these are the muscles, so movement of the trunk, right? Trunk movements. So these are some of the important functions of the abdominal muscle. No, it is a single muscle. It is a single, rectus abdominis is a single muscle, but it is with tendinous intersection. Otherwise, it works as one, right? It works as one. And this line which is in between, right? This is line, so we'll call it linea, and it is white, so we'll call it alba, right? Alba. Alba means white. Okay. Now here are all our favorite muscles, right? Which we discussed during our lower limb also, right? So here is the commonest, our most favorite, that is the psoas major, right? This is psoas major. And chota bhai of this one, right? That one is psoas minor, right? Psoas minor. And this psoas brothers, they do have business relation with this. So that's right, iliacus. And that's why collectively they were called as the iliopsoas over here, right? Iliopsoas. The speciality of this iliopsoas is that they were crossing the hip joint, right? And they were getting inserted all the way onto the femur. Okay, so that is iliacus. Then the muscle which is over here. Let's talk about this one, right? We saw that is where it was getting inserted onto those vertebrae. So that is none other than the quadratus lumborum, right? Quadratus lumborum. A question was asked that, okay, we can see the psoas major and the quadratus lumborum attachment. Where is psoas minor? See, psoas minor's attachment is actually very small, right? So that's why on every vertebra you won't be getting, or you won't be watching its impression, right? Okay. Over here, watch for this. This is this one going all the way down, and this one, which is the smaller one. These are crus of diaphragm, right? Crus of diaphragm. So diaphragm in itself would be a huge topic. So all we need to see or understand right now that these two, one is the right crus and second one is the left crus of the diaphragm, right? And finally, all those muscles, right, which we see over here, the muscles which were forming actually the floor of the femoral triangle, right? So this is like pectineus, and then after pectineus we know there was adductor brevis, adductor longus, and the floor which was formed by adductor magnus, right? All those, you know it very well. Okay, here it is, one more view, right? This muscle. So there is crus, they are seen now much better. Say this one is the right crus, correct? Okay, so this muscle is intertransversalis muscle, right? Transverse process, in between the transverse process. So intertransversalis muscle. That's easy, right? This is iliacus, and then there is this one is what? That one is obturator foramen. So this muscle has to be obturator externus because this is coming out, right? The muscle which will be going inside, that would be the obturator internus. So this is obturator externus, right? Obturator externus. All right. So these are the main muscles which we were supposed to know. So here is our entire abdominal skeleton, and that's the smiley, right? That's the smiley. So why do we even write? We can just do it like this, right? That's the smiley. And at one particular angle, right, it looks actually very cute. Okay, so here we start with the vessels, right? With the vessels. We start with, every time as our protocol, we start with heart, right? In heart, from the left ventricle. From left ventricle comes out the aorta, right? That aorta which is like ascending aorta, then there is arch of aorta, and then there is a descending aorta, right? Then there is a descending aorta, ascending, arch, and the descending aorta, and then there is, that is what is called as the thoracic aorta, and we are interested in as it crosses the diaphragm and it enters into the abdomen, right? As it enters into the abdomen. So that's what is called as the abdominal aorta. So here is the abdominal aorta. Now in abdomen, right, there are several branches, and yes, bluntly I'm telling you, need to remember every branch of abdominal aorta. No doubt about it, right? No doubt about it. You need to remember, and yes, within next half an hour you'll remember every branch, because the pattern itself is amazing. It's so simple and it's so good, right? So first this abdominal aorta, it divides into, yes, you know that, right? It divides into common iliac artery, correct? Right and left, right? You understand that. And then this common iliac will be divided into external iliac and internal iliac. That external iliac will continue as the femoral artery and all those things, right? Yes, right? Okay. So you know this part. Let's move further. Now here it is. This common iliac, right? That is internal, external, right? So this is the common iliac artery, and this one would be the external iliac. This external iliac, as it crosses the inguinal ligament, then we call this thing as femoral artery, right? Femoral artery, and then there is profunda femoris, etc., etc. Right? And so that this thing goes into the lower limb. Lower limb. Okay. But what is that rest of the jungle? So let's start deciphering it. Right? See, let's zoom this. We can figure out that certain organs are like this. Certain organs are like this, right? And then there is someone like this over here. Yes, say, without saying, this is like spleen, right? And this is like that kidney, right? And opposite side, so right and left. Okay, let's go systematically one by one. Now, if you really know this, that which are the branches, that is very good, right? But in case if you are not aware about all those branches, nothing to worry. It is so simple, right? Completely logical, but we'll go it in such a way that you will also understand the entire hepatic circulation. So much so, my plan is even to go into the depth of liver, so that we finish that part, that what is this portal triad, right? What really happens? Where is that central vein? Where are those hepatocytes, right? How do they drain, right? All those things we finish today only. Okay, so first thing first, this is the point when the aorta, that's our aorta, right? This is our aorta. That's our aorta when it dips and it enters into the abdomen, and immediately this is what diaphragm, right? So it has to give something to diaphragm. So it'll say, okay, diaphragm, take our first branch, and that is because it is from the inferior side. So this is inferior phrenic, right? Diaphragm, other name of diaphragm is phrenic. So inferior phrenic artery, right? This is right, that is left. So first branch, so we just name as 1, right? Pretty easy. Okay, as we go down now, see, as we go down, we just can't miss it. It's huge one, big one, right? Say these were all phrenic, right? This was phrenic, inferior phrenic, right? Just for reference, inferior phrenic. That one, this is called as the big one, big thing. So it will call it trunk, right? And it is called as the celiac trunk. Celiac trunk, right? It is short, and 2 major vessels will be coming out of it. The first one, see how gracefully it is entering, and classically it is forming one organ, and that is spleen, right? So this is splenic artery, right? So that is splenic artery. Now this artery is tortuous, right? If you see, it is quite tortuous. Why tortuous? Don't worry about it. Just see that it is tortuous, because currently our main idea is to learn all the vessels. Because when we'll be learning spleen, at that point we'll actually go for all the discussions that why it is tortuous, right? What really happens when there is splenic rupture, right? This is an highly vascular organ, right? All those things we'll be talking about. So here is the first splenic, right? Now we'll keep on revising it because within 15 minutes we want to understand all the arteries. So we talked about first one, this one, inferior phrenic, and that one was celiac trunk, right? And this is splenic, right? Pretty good. Okay, let's move further. Now starts the real journey, right? This is the area which is reasonably, say, confusing. Celiac trunk, and this is what is called as the common hepatic artery. Now remember, liver has got dual circulation, right? There will be one artery and two veins. And why such thing? That's what we'll be understanding it, right? So remember, this is like first we need to give oxygen to liver, right? So this would be the place for liver, and as this is coming directly from left ventricle, so it will be giving oxygen to liver. So first we need to give oxygen to liver. Liver is doing what? Liver is like a chemical factory, right? Yeah, fine, very nice. Right, you are helping me a lot, right? Thank you so much. I like this. Okay, and yes, who has asked? Yes, Hari. This is fine, means whenever you have got any of the doubt, because at times I take it for granted that okay, tortuous means I should have said that something which is not straight, which is going like a snake, right? But yes, there are some very good friends and then they are explaining it, so I'm happy. Okay, so we need to give oxygen to liver, right? So this is coming from left ventricle, so it gives oxygen, right? Well, every artery gives oxygen, but I have written this thing deliberately, right? We'll come to this point that why I wrote it. So let's write down the name, and that is common hepatic artery, right? Hepatic means something which is going to liver, right? Another name of liver. So this was celiac, hepatic, this is splenic, this was phrenic, inferior phrenic, right and left. Okay, moving further. Now before we go for it, right, say this would be something like this. Liver would be something like this, right? Which would be divided into two parts. And liver is like a marathon topic. Amazing. Means all those ligaments of liver, lobes of liver, what it will do, right? So much. So this is like right and the left lobe of liver, right? These will be the lobes. There would be gallbladder over here, right? Gallbladder, which makes bile, right? What bile does? Bile does the process of, in simple words, when we eat that butter, right? So that plate, you try to clean it, you just can't clean it with simple water. What you do, you just put a drop of soap and instantly it is cleaned, right? Because it breaks that surface tension. So bile is doing exactly the same process, the process of what's called as the saponification, right? Saponification means came from the word soap, right? So it breaks all those fat globules into smaller ones and then they can be easily digested. So that is the gallbladder, what it will be doing. So over here, say it was like celiac trunk, right? It was like celiac trunk was there, and from celiac trunk, that was the splenic artery, correct? That was the splenic artery, and from here it was the common hepatic artery. Deliberately I have written CHA like this because when I'll be showing you ultrasound plates, right? So in ultrasound, you actually, while doing ultrasound, you cannot type really common hepatic artery. You can, but it takes so much of time, right? So you really do it like CHA, right? Gallbladder is always GB, right? Lobe left is just like L, right is R, right? So I'll that's why I wrote it like CHA. Now this common hepatic artery will be dividing into two parts, right? Obviously one for each lobe. So that is right hepatic artery, right? So RHA, and the left hepatic artery. So this is easy. right? Makes sense. So left hepatic artery. Remember, we are just sending the oxygen, correct? Okay. And liver is special because it has got dual blood supply. Now, what's that dual blood supply? We'll see within few minutes. Okay. So we saw how many? We saw that inferior phrenic, celiac trunk, splenic, common hepatic, right? So here is the celiac and this is splenic. This is common hepatic, right? Artery, celiac trunk, splenic artery. Just above, right, from both the sides, there is emergence of, that is what is called as the middle suprarenal. Suprarenal means these are adrenals, right? Suprarenal artery. Now, adrenal gland, that is like a star, right? It has got so many things to learn. So actually, yes, that would be also a major topic. That's why this abdomen is like an AHA series, right? Every topic is like a cream topic. Now, this is highly vascular because it has got a super endocrine function, right? So this is highly vascular. And that's why there'll be heavy anastomosis, as you can see, right? There would be heavy anastomosis. So one of the artery which is coming directly from the aorta, and that is middle suprarenal artery. It means there'll be other suprarenals also. Definitely, they will be there, right? And we'll touch them as they come. So here it is. So we learn inferior phrenic, celiac trunk, splenic artery, common hepatic artery, and the middle suprarenal artery. Easy, right? Because they are like just as the organs are coming and they are appearing, right? Here it is. These are the adrenals. I just added those adrenals so that you can really see that how they are getting. See, they are getting all those anastomosis, right? And here is the blood vessels. Other vessels are also going, but don't worry. When we'll be discussing, right? These are the like kidneys, and in fact they will be over here, right? Okay, yeah, they will be over here, not seen this. Okay, here it is. In this it is seen. These are adrenals. So these are adrenals, adrenal glands, or the suprarenal, right? Suprarenal is above the kidneys. So that's the kidney and this is the adrenal, right? Shape of both are different, right and left. They both are different, but that's fine, right? Let's move further. This is superior mesenteric artery. Superior mesenteric artery. Now, why there are so many arteries, right? See, there are so many organs. So for every organ, there is a specific artery which is assigned. The superior mesenteric artery and the inferior, because you must have guessed from the name itself, superior, so there has to be inferior. So superior mesenteric artery, inferior mesenteric artery, right? They will be playing a major role in the blood supply of entire GIT, and it has to do something with the embryology. So yes, we'll be learning the embryology also, because then and then you'll be able to understand all those peritoneal folds. Otherwise, it's like we keep on guessing that, okay, right? And it's like a literal, the greater omentum is like this, lesser omentum is like this. No, we'll not keep anything guessing. Actually, we'll use a cloth and we'll see that how it really folds, and we'll actually understand the every peritoneal fold, right? When we do that, at that point we'll understand that, okay, these superior mesenteric and inferior mesenteric, they are also getting rotated, and that's how they supply to the various parts of the GIT, right? So it would be a combination of embryology, some movements, vascular system, everything combined, right? So this is superior mesenteric artery. Close your eyes and quickly, can you just go through? Because see, if you are knowing, it is well and good, but if not, right, just go through all the arteries which we discussed, right, very quickly. So it was like inferior phrenic, we talked about celiac trunk, we talked about splenic, then we talked about that common hepatic artery, then we talked about middle suprarenal artery, and then we talked about superior mesenteric artery, right? Okay. Easy, right? These are renal, right? Renal arteries. Bile breakdown of fats, that is very good. So these are renal arteries, right? Renal arteries which are for kidney. So that is the right renal artery and the left renal arteries. Now there are branches which will be going to suprarenals, etc. But everything when we'll be discussing that. So here it is, this one, that is the right and left renal artery. Correct? Fine. Now over here, one point which is to be remembered. Always the ureter is behind the artery, right? Just remember this small point that over here, this is the ureter. So ureter is behind the artery, right? And over here we don't see the veins, but anterior most, right? Anterior most is vein, right? That is renal vein. So I'm writing it on the kidney itself. The anterior most is the renal vein. So yes, these are the kidneys, right kidney and the left kidney. Yeah, this is renal artery. This is renal artery, right? Now here it is. This is gonadal artery. Gonadal artery. So in case of male, that would be like called as the testicular artery, right? And in case of females, it would be called as the ovarian artery. But these two arteries, they right from the birth, they know that they will be traveling a long distance, see, all the way from here until this point. That's what they travel. So they'll be having a long course, right? So that is, these are the gonadal arteries. Okay. Moving on to the next one. Superior mesenteric was there. This one is inferior mesenteric. Right? That's inferior mesenteric artery. Right? Here it is. Inferior mesenteric. And see, we are almost at a lower level. This is where common iliac, right common iliac and the left common iliac arteries, they are there. Right? So this is where the inferior mesenteric is there. And then you know this, right? Common iliac, right? Right and left, you know that. And then it divides and continues as the femoral, right? As a femoral artery. That is the external one. So here it is, all the arteries, right? All the arteries listed. So we put this thing as number 1, inferior phrenic artery, fine, which was going to diaphragm. Then the celiac trunk, that thick one which was coming out, and it was giving, right, what on one side the splenic artery, and then on other side common hepatic artery, right? Common hepatic artery. Then there was middle suprarenal, yes. Then there was superior mesenteric, right, which was just below We saw that. Then these are the graceful renal arteries, number 5, number 6, right? Because on the both the sides. And then this gonadal artery, which was traveling such a long distance, that's the abdominal aorta. And this one is the inferior mesenteric artery. And then we have got the right and the left common iliac arteries. Done. Right? Not tough. Right? Actually, every artery is a big topic in itself, and we'll be discussing all these as we proceed. Right? Right now, let's finish first. We have just started abdomen, right? So don't worry, right? We'll be talking about the next regions as we proceed. Okay. Now comes the vein part, right? Now this is what is bit tricky. Veins, right? When we talk about veins, one thing is that psychologically we feel that your veins are all ulta, right? Yeah, but well, it is like that because they carry the blood from organ to the heart. So it is the reverse direction. So here it is the inferior, right? We start with the easier one, inferior vena cava, right? It is this inferior vena cava which will be taking the blood to the right atrium. How is it forming? It is simply because of that both the common iliac, right? They will be draining into common iliac veins. They will be draining into inferior vena cava. So far so easy, right? And similarly over there, this would be like external iliac vein, and this one would be like, I'm writing on that smiley, really? Okay, let him smile. So this is internal iliac vein, right? All good? Oh yes, this is an interesting topic, right? See those two veins, one which is called as the azygos, right, on the right side, and on the left side it is called as the hemiazygos. Now what's this mystery of all these azygos veins? So this is inferior vena cava, this is aorta, correct? This is aorta. For this to understand azygos system, so we'll draw a very simple diagram. This is superior vena cava, correct? Superior vena cava, it will open into right atrium. Then in right atrium, there will be opening of inferior vena cava. So far easy, right? Now, between superior vena cava and inferior vena cava, there is a communication. And this communication is on the right side. It is nothing but azygos vein. So that's azygos on the right hand side, right? So azygos is something which drains thoracic wall and the upper lumbar region, right? Thoracic wall and upper lumbar region. So this is the reason that it would be having so many, right? All those tributaries, right? They all will be ending up into azygos vein. Interestingly, this is what is happening on right side, but not on the left side. On the left side, things are a bit different. It is like this. So, like this. That's the left side, right? And it is like this. So it means, again, there would be thoracic wall and upper lumbar region even on the left side, right? But this is now called as the hemiazygos. hemiazygos because it will be draining into the azygos vein here. Similarly, this upper part, right? All those there. But this is called as the accessory hemiazygos vein. Azygos vein, right? This one. So again, it would be draining into the azygos vein, correct? So let me highlight this, and that one, right? So this is how the structure is there. Now we just, because we are discussing it, right, we just add some points into that. This azygos system is actually into the posterior mediastinum, and it is just near to the spine, right? Very much on the spine, on the posterior wall. They will be seen when we'll be watching the real structures, real specimens. Azygos vein has got some variations. Now those variations, one of the variation is like, say this is on the right side, right? And at this level over here, there is right renal and left renal, right? This is the level which we must know, right renal and the left renal. So it emerges just above it. Now what variations are there? One is the standard protocol is that over there, this is the subcostal, right? Subcostal. And then there is another one that is ascending lumbar, right? Ascending lumbar. So obviously this is because it is happening on right side. So it would be right subcostal. It is vein, right ascending lumbar vein, and they form this azygos. So this is number one, first variation, right? This is normal. Sometimes it can emerge directly as a continuation of subcostal only. That is second. And the third variation could be when it is emerging only from IVC, so that's the third variation, right? These are the three normal variations. There are few others, but these much are sufficient to know. So otherwise, all these are like its tributaries, right? So there'll be tributaries which are emerging from all those say intercostal veins, right? Posterior intercostal veins. Then we have got this hemiazygos, which is draining into azygos, this accessory hemiazygos, which is draining into it. Then these are the right subcostal vein, right ascending lumbar vein. All these you can list as the tributaries. Got it? Yes. Yeah, that is bacha of azygos. Okay, right? So this is how these azygos guys, right? They keep on doing their business, right? But as such, they are cooperative, right? This azygos is telling that as such, I'm going to superior vena cava. So yaar, ao azygos, accessory and hemi. You just give your supply to me, and I'll take it to say right atrium via superior vena cava. Interestingly, when there is obstruction, right, these things help, because then there will be tortuosity, then there will be all those collateral circulations which will develop, and that is what we'll see when we'll be discussing the clinical part, right? So I think this part is crystal clear that basically a azygos system is doing nothing. It is draining thoracic wall and the lumbar regions, upper lumbar regions, and classically connects inferior vena cava and the superior vena cava, right? Moving further, now starts our vein. This one, right? Suddenly, from where it has emerged, right? It was nowhere, and from the direction we can see that it is going for the liver. Yes, you are right. So we'll just call it a hepatic portal vein. From where this word portal came, Portal came because there would be one another hepatic. Chances are very high that it will come. That's why they must have named it. Okay, we just keep it in mind, right? So this is hepatic portal vein because it will be making something very important. And where it is going? Yes, we guessed it, right? We guessed it that it will be going into liver. So it is going in liver. All right, fine. Why it is going in liver? Why should it go? Right? When already the blood is taken by all those common hepatic artery. So this question is still unanswered, right? We'll answer that. So see, it is definitely going into the liver right side and the left side, right? Fine. And there has to be an organ, right? See the shape and see the tortuosity, right? This snake-like. So it is splenic vein. Okay, right? This makes sense. That is splenic vein. This is hepatic portal vein, and it was going into liver. Fine. And who is she? Right? This is superior mesenteric vein. This is superior mesenteric vein. So this means this superior mesenteric vein, it is coming from below, and here it joins, right, with this splenic vein, right? That splenic vein drains into it. And then collectively they all go into the liver. Good one. Okay. But can you really see one more structure over here which is going like this, right? I have highlighted it. Let's see it much better in another image. Meantime, they are, right, easy to know. So we are shuffling between two. Yes, this is what? This is inferior vena cava. And in inferior vena cava, these are what? These are the renal veins, right? So it means there is right renal, left renal vein. But who is he? Say this one, this one. That is what we just saw, right? This is superior mesenteric vein. This is splenic vein. And then that's the journey towards that hepatic portal vein, and then it will go into the liver. So it means those two systems are working, right? Splenic supramesenteric is portal vein. Yes, yes. And here it is, right? See, this one is splenic. This one is superior mesenteric. So this is 1, this is 2, and they are making this hepatic portal vein, correct? That is how it is getting formed. And this inferior mesenteric vein, where is it? This one is inferior mesenteric. This one, this is what I marked, right? And we'll say that. So this inferior mesenteric vein is landing into splenic vein. So simply speaking, so this is 4, right? So if I really want to draw, I would draw it something like this, this and this. But this is the easiest thing. This is inferior mesenteric vein. This is superior mesenteric vein. This is splenic vein. And this is hepatic portal vein. Done, right? So this is superior mesenteric. Inferior mesenteric will land into splenic. Splenic and superior mesenteric, they will join hands. They'll go into this hepatic portal vein. Hepatic portal vein will divide into right and left, right? And they will enter into the liver, right? Okay. So why such systems? Why such this dual pattern? Why liver is privileged with such thing? See, that's the liver, right? Here is the heart, right? As such, heart is not like that. This is a bit of romantic heart, but no problems. Right? So from heart, the oxygenated blood will be going into the liver, right? So that oxygenated blood, that is by hepatic artery, correct? And then this blood will also go to GIT, right? GIT, and it will give oxygen to them also. But then all the nutrients, they will be absorbed, and then those superior mesenteric veins and inferior mesenteric veins from various parts, right, they will be collecting carbon dioxide plus nutrients, right, plus nutrients. They all would be collected, right? And then via this hepatic portal or portal, right, they will be going into the liver. So this portal vein or the hepatic portal vein, right, it is taking carbon dioxide and the nutrients, right, and the nutrients into the liver. Now liver starts functioning, right, because liver is what? Liver is like our chemical factory. So once liver processes everything, liver would say, okay, my function is complete, right? Then it will drain various things into various channels, everything fine. But finally, what about that CO2 produced by liver? So it will say, okay, hepatic vein, put it back into the heart. So that's where the hepatic vein will come into picture. Hepatic vein. This is how systems they work, right? And on top of it, say one, it is the metabolism of nutrients, right? That is one thing, metabolism of nutrients. And second is detoxification, right? So that's the reason it is said that whatever we eat, whatever we consume, right, it is actually the entire load is taken by the liver. That is taken by the liver. And third thing, that liver, as we said, that it produces bile, right? It produces bile, which is used for that saponification. So this bile is sent to gallbladder, right? Function of gallbladder, just to one, storage. That's good. And second, actually it increases concentration by almost 50 times, right? So increasing the concentration, and thus it goes for the process of saponification. Fair enough, right? So this is how the liver would be functioning. Okay. Yes, liver is a big topic and we'll be discussing it. Now, see, as we are, that's right. It delivers carbon dioxide and the nutrients. Now see, just to answer this thing in slightly more detail, right? If we really go for the histology, right? If we go for, it would be much interesting to even learn this thing at this point of time. So liver is divided into small, what's called as the lobules, right? It is divided into those lobules, and those lobules are like, say, like this, right? Then hexagonal, like this. The smallest component is what's called as the hepatocyte, right? It is called as the hepatocyte. It is in this hepatocyte there would be, like, say, those mitochondria, right? Mitochondria. There would be, so these are like those mitochondria, they'll be doing what? They are powerhouse, right? They will be giving energy. Who is demanding the energy? Demand is by endoplasmic reticulum, right? Because they will be having that secretory function. So all those endoplasmic reticulum, right, endoplasmic reticulum, so they will be having that secretory function. And that's how the metabolism goes. So where are these hepatocytes? They are arranged in a very specific way. They are arranged like this. Goal, 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 goal. This way, this way, this way, that way. Here it is, and here it is. That's how they are arranged for all the lobules, right? Okay, right. So this part is clear. Now let's go into the detail of this one piece. So if we just zoom this part, right, this part, because it will giving us a complete understanding of where is that portal vein, where is that bile duct, what happens to that hepatic artery, and what happens to that central vein, everything, right? So let's zoom this portion, full page. So bigger one, right? That over here it was the central vein, right? And then all those hepatocytes, right? So let's make them big, right? Then over here, so these are all hepatocytes. Over here, right? That is the portal vein. Okay, let's make it of blue color. That would be much easy. Here it is, the portal vein, right? Portal vein. From this portal vein, right, the veins which are going from both the sides, right? And then this is what there would be that artery, right? So even that one is also draining into it. So this is a sort of mixed blood which is going into the central vein. And where what is happening, there is one more structure, and this is what, this is the bile duct, right? So these biliary canaliculi, right, they all are coming from here, right? They all are coming from here. Why so? Because it is this portion, that's where every hepatocyte, right, will be releasing this bile, and that would be collected by this biliary canaliculi, right? Biliary canaliculi, and it is coming into this bile duct, right? Bile duct. And all of them, they are arranged like this, right, like this, and collectively this portion is what is called as the portal triad. Portal triad. Hepatic artery, right? So this is hepatic artery, portal vein, and bile duct. Hepatic artery, portal vein, and bile duct, right? Do remember, they form portal triad, right? So this is where the entire raw material comes, and then it is processed by all those hepatocytes, and finally whatever the CO2 etc. is. So that form material that is drained by the bile duct, and from here it goes into the gallbladder, right? Hepatocytes are these. These are hepatocytes, and all these white portion, these are all hepatocytes, right? Everywhere. Okay, let me draw one more thing. So when these hepatocytes, they are over here, right? So in between, right, these are all endothelial cells. endothelial cell. So the space which is in between, right? The space which is in between, that is called as space of Disse. All these things, they will be discussed still in more depth when we'll be talking about the liver. This is just for the understanding that this is what really happens. See, by the way, the gallbladder, right? Say, let's draw this. So right and the left, right? Here and here, right? They will be hepatic ducts, right? Right hepatic duct and the left hepatic bile duct, right? These are the hepatic ducts. These ducts, they meet, right? Because they are carrying the bile. They make that what's called as the common hepatic duct. Now this common hepatic duct, right? It goes into the gallbladder, right? So this portion which is going into the bladder, right? This is the gallbladder. So it is called as cystic duct, right? So we'll call this thing as cystic duct because it is going into a cyst. Cyst is something which is like a cavity. So cystic duct, it is going into that. Now whenever the demand increases, gallbladder contracts and it throws its content into what's called as the CBD, common bile duct, right? Common bile duct, right? And this common bile duct, it goes down, right? And from here comes the pancreatic duct, right? Both of them meet and then they open into the D2. That is the second part of duodenum, right? D2 is second part of D2 is second part of duodenum. And that portion is called as ampulla of Vater, right? Ampulla of Vater. So that's how the entire journey is there, right? So this was for today, right? So do revise this, and next time we'll be learning all those procedures, that is CT, MRI, radionuclide, everything, right? And then actually our abdomen will start. But by that time, when we'll start the abdomen, we'll be having this ground, a nice ground ready. So you'll find that every topic will become much more interesting and at the same time much easier, right? So thank you so much. Have a great weekend and we meet soon. Bye-bye.